If you are over 65, stop for a moment and really listen, because what I'm about to tell you goes against what most people believe. Yet every surgeon, physiotherapist, and mobility researcher already knows it's true. Walking, while healthy, is not enough to keep your legs strong as you age. Not even close. If walking alone worked, then millions of older adults who walk every day wouldn't struggle to climb stairs. They wouldn't have trouble getting out of a chair. Their knees wouldn't shake. They wouldn't lose balance the moment they step on uneven ground. But they do. Surgeons see this every week. People who walk daily, sometimes for miles, yet their muscles continue shrinking, their balance keeps declining, and their risk of falling increases every single year. The truth is simple. Walking uses only a small portion of your leg muscles. It does not strengthen the muscles that aging attacks the fastest. So stay with me for a few minutes, because you're about to learn 3 surgeon-approved exercises that build more leg strength than walking, especially after age 65. These movements are gentle, joint-safe, and specifically chosen for older adults who want strength without risky, high-impact exercise. The first movement is standing up from a chair. Surgeons and physiotherapists use one simple test to predict whether an older adult will remain independent or need long-term assistance. Can they stand up from a chair without using their hands? This single movement reveals leg strength, balance, mobility, and fall risk all at once. It matters because standing up activates the exact muscles that protect you as you age: the quadriceps, glutes, hips, core, and deep stabilizers around the knees. Walking barely activates these muscles, but standing up from a chair activates them all together. To do it, sit on a sturdy chair with your feet shoulder-width apart. Lean slightly forward. Push through your legs and stand up without using your hands if you can. Then lower yourself slowly back down. Perform 8 to 12 repetitions, rest, and repeat for a second set. If you need to use your hands, that's completely fine. Use them lightly. Over time, your legs will grow strong enough to support your body on their own. Research shows that people who perform better at this movement walk faster, climb stairs more easily, stay independent longer, and experience fewer falls. It trains the exact motion you use every time you rise from a bed, toilet, sofa, or car seat, something walking does not train at all. Within weeks, standing becomes easier. Within months, everyday movements feel safer and more controlled. The second movement is heel raises. When people talk about leg strength, they focus on thighs and hips, but the calves are often forgotten. These muscles push your body forward, stabilize your ankles, and help you maintain balance with every step. When they weaken, walking slows, stairs become harder, and fall risk rises dramatically. After age 65, calf muscles shrink faster than almost any other muscle in the body, and walking does not strengthen them enough to stop this process. That's why surgeons often call the calves the second heart of the legs. To do this movement, stand near a wall or chair for support. Rise onto your toes as high as you comfortably can. Pause for 1 second at the top, then lower slowly. Perform 12 to 15 repetitions for 2 to 3 sets. Walking only uses about 20 to 30% of your calf strength. Heel raises use up to 80 to 100%. This strengthens ankle stabilizers, foot muscles, the Achilles tendon, and the deep calf fibers responsible for balance. Studies show that older adults who regularly perform calf raises can significantly reduce their risk of falling, especially on stairs, uneven ground, and slippery surfaces. Over time, your steps feel lighter, quicker, and more stable because your muscles are finally strong enough to support you. The third movement is marching knee lifts. One of the biggest mobility problems surgeons see after 65 is hip flexor weakness. These muscles lift your legs and help you climb stairs, step into a car, clear curbs, and avoid tripping. When they weaken, people begin shuffling, their feet don't lift high enough, and balance declines rapidly. Walking does almost nothing to strengthen hip flexors, which is why so many people who walk daily still struggle with stairs or stepping over small obstacles. To perform this movement, hold the back of a chair or a counter. Lift one knee toward hip height or as high as you comfortably can. Lower it slowly, then switch legs. Repeat 10 to 15 times per side for 2 sets. This movement strengthens the muscles responsible for safe, stable walking. It retrains your nervous system to lift your feet higher, reduces tripping risk, and strengthens the deep pelvic muscles that protect your spine and hips. If this feels difficult at first, it's not a sign you're too weak, it's a sign these muscles have been neglected. With consistent practice, confidence returns to every step you take. Walking is good for your heart, lungs, and circulation, but walking does not stop muscle loss. After 65, muscle loss accelerates every year unless you actively challenge your muscles. Walking builds endurance. These movements build strength. Endurance helps you move. Strength keeps you independent. Walking keeps you healthy. Strength keeps you safe. Think of walking as maintaining the engine of a car. These exercises reinforce the frame, tires, and brakes. You need both if you want to move safely and confidently as you age. For best results, perform these movements 3 to 4 days per week. Move slowly and with control. Rest as needed and focus on quality rather than speed. Most people feel improvement within 2 weeks. Within 8 weeks, daily movement becomes noticeably easier. Within a few months, balance improves and fear of falling decreases. Muscles can grow at any age, even in your 70s, 80s, and 90s. Surgeons and physical therapists see this every day, and research confirms it. Your body is not failing you. It simply hasn't been given the right signals. Walking sends one signal. These movements send the missing ones.